Hello, viewers. Good day and welcome to this impromptu interview. Well, not so impromptu because I gave a notice earlier of the fact that we will have Dr. Doobay with us once again. And this is as a result of where it's called, MDJ, called popular demand. Like when you got to dance and the dance suite, right? A lot of people have reached out to me and say, Critic, you know, we're affected by or having a number of issues as a result of being diabetics, whether it's losing a limb, whether it's going through dialysis, and a number of other issues. Nobody, I could safely say, nobody plays a more integral role personally in addressing the situation of diabetes and how diabetes affect Guyanese more than Dr. Doobay, who is in our studio here, and we're going to have another educational interview with him. And again, this is just the second of many more such interviews that we're looking to educate Guyanese about how to better take care of themselves and their health and what they can do to live a longer, healthier life. Dr. Doobay, thanks once again.
Thank you.
For taking time out of your busy schedule and like you always do, unlike me, who is motivated from a financial perspective, is out of your love for people. You come and educate people as a result of wanting to give back and support Guyanese. You started the Dubai Gafour's dialysis center at Annandale and a number of other centers. A lot of people don't know Dr. Dubay, and I think you told me, and it fly past my head and two times, where the center is was your childhood home.
Oh,
You got the family, you got your family
to give over.
to give over this place for you to turn it into a clinic and a dialysis center to help Guyanese.
Correct.
We want to thank you once again for that, Dr. Dubay. I know the last time we captured everything. This time the intention is to really talk about the connection between high blood pressure and diabetes. But give us a little synopsis again of diabetes and how could we address that? Then I will try to get an understanding of blood pressure and the correlation between the two.
Just to recap, thank you for having me, by the way.
Most welcome.
And quite a lot of people have been telling me that it was good to be on your program. And even in Canada, they are looking at it. And to recap, and you can come in anytime, to recap about diabetes, we treat diabetes with insulin and we treat diabetes with metformin or all these other drugs. But that is like treating a fever if you have pneumonia. Like giving them Panadol or giving them aspirin. You're treating
the fever. It doesn't address the pneumonia.
Exactly.
What would have caused the fever.
Exactly. So, and I just want to re-emphasize that if you have diabetes, you can get out of diabetes, providing you live a disciplined life. And I just want to remind our viewers that both you and I talked about intermittent fasting. Do not eat too much carbohydrates. Sugar is a no-no, and even salt must be very moderate and not too much of salt because that'll go towards hypertension. We'll talk about that later on. But for diabetes, I have got about 20 people off their medications in Toronto where I am, and this is because they are determined to live the lifestyle that I've told them to live. Because they are diabetic, they can't metabolize. Metabolize means use up sugar. The sugar is too much in the blood. And when the sugar is too much in the blood, it has nowhere to go except into the fat cells. Most diabetics you will see are fat. Most diabetics have a big Canadian Tire belly because the fat in the belly absorbs the insulin. And if I may remind you that I saw your picture. And yesterday, I think it was, the day before, your side view of your belly, which is not a very pleasing picture. And that is the picture you get in diabetics usually. But there are also diabetics who are thin people. They are thin outside but fat inside, meaning the fat is in the what we call viscera, but
Visceral, yeah.
visceral fat, mean fat around the organs.
In between the organs and around the organs.
Correct. You're a doctor yourself. Yes. So they are fat. They are thin outside but fat inside, and there are people who are fat outside and thin inside. So most diabetics are fat outside. Their belly is big, and that's where the fat is.
Obesity and
Yeah,
for
but-
the most part, obesity and diabetes go hand in
Yeah,
hand.
but the obesity of these people are mostly in the belly. You look at it; they're mostly in the belly. They have thin legs, thin thighs, thin arms, but a big pot belly. And this is where the fat, the sugar goes into the fat cells. And when you go to the doctor gives you insulin. So you put more sugar into the fat cell. So if you become fatter. You have enough insulin already, which is not being used. You're getting more insulin, which makes you fatter and defeats the whole purpose. So what I'm trying to say, if you have diabetes, do not despair. You can get better because, as you mentioned earlier, if you have diabetes, it affects your eyes, it affects your kidneys, it affects your heart vessels, so you get heart attacks. It affects your limb vessels, so your limb gets chopped off. And all of us know of people who have had diabetes who have lost their limbs. So, because of this, we should try to control it. And your body cannot use sugar like another person. Because of that, you're diabetic. So, you have to do something. Do not allow the body to be overloaded with sugar, number one. And not only the sugar, the demerara sugar, bread. As soon as you eat it, it converts into sugar. Aloo, potato, roti. As soon as you eat it, it's converted into sugar. So I'm not saying not to eat it, but I'm saying to you, use your blood test, have a blood test, and make sure that your sugar is okay and you can eat a little piece today. But if your sugar is high, don't eat any.
But Doc, earlier, just a moment ago, you said, do not despair. And the fact remains that in certain cases, diabetes, or when you're diagnosed as being a diabetic, is reversible.
It's reversible.
You understand? It is reversible.
Of course.
And I think in what you put over earlier, Doc, it sounded a little bit extreme in diet, your diet and what you're eating. But I can tell you there's still a lot more things you can eat. In addition to having this healthier lifestyle, in addition to reversing, a lot of times it's not only what you eat, is your cooking methods. Because you might assume that you can eat steam greens, you could steam some greens, but people think or stir-fry greens, and then they use oils that add up to being saturated fat, and they don't realize that outweighs the health benefits of steamed greens.
Correct.
Just some steamed green, how it's cooked also. Because you like greens, you like pumpkin. But when you go to Jandy, if you don't know, a lot of times when you eat the pumpkin, it tastes nice. It's because they put bun sugar. They bun the sugar, then do the pumpkin. So a lot of times it's how the food is cooked. Also, very important in watching at what you cook. What I've learned, Doc, and I try to tell people or teach people now, I take a lot of care and time in what I eat. So it becomes a process. Now, eating is not supposed to be a simple thing because this is the fuel to which you use to take you places, right? To help you with your growth, to help with strengthening the bones, the eyes, mental function, blood flow. Everything that you consume has some benefit or should have some benefit to your livelihood and betterment in your life. So when you're going to just take a drink and drink it down and even notice and then not even checking that, well, I had 2 for the day. Some people are having 4 and 5 and 6 sodas every time they feel a little run down, they go and drink a soda. No. In my case, I consume only water for liquids. Black coffee, very rarely. My recreational drink is black coffee. and tea. So even to that, I use water. But even water, I know that the amounts of water that I use on a daily basis is between 5 and 8 of these bottles. So I don't just drink water because I feel like drinking water. I drink water purposefully.
Yes.
You understand?
You have to.
I think about how this water gets in the system and make sure there's maybe sometime a little bit of sodium added to make sure that gets in my cells, right?
We have to understand that 70% of our body is water.
Is water. Yeah.
70%. And especially a place like this where they get dehydrated, if you go outside and you work a lot outside, you have to drink water, otherwise the cells get dehydrated and they don't function as well. And when the cells get dehydrated, there's something in the cell called a mitochondria, which gives you the energy. And that is where autophagy comes in. We branch off too much here. But anyway, let's talk about water. Water is important. And we'll talk about mitochondria afterwards. And what the mitochondria determines the energy in your body. And the mitochondria is in the cell. So, do you think we're getting off topic here?
No, not once it's educational for the people.
So the water is important. As you get older, mitochondria decreases in its energy production. And what makes the mitochondria strong as you get older is autophagy and exercise and walking and eating green leafy vegetables. These make the mitochondria in your cell strong. And the mitochondria gives you what is called ATP, adenosine triphosphate, which gives you the energy and make you strong and energetic. That's one. But you mentioned something about blood flow, and I would like to talk about that when you think it's
So if I could expound a little bit, since autophagy is something that I have initiated several times, and it comes naturally. The body does it naturally, but you have to initiate it. It doesn't come naturally and you just sit down and you enter autophagy. Autophagy is when your body is in a fasting state and you would have gone past ketosis, which is fat burning. And then within a certain hours, you enter autophagy where the body starts to rejuvenate cells, starts looking for weak dead cells and so on.
removing it.
And remove it from the body, right? So that is autophagy. And I have entered that state, and you have to initiate that state in your body by fasting, right? That really, really helps you. So just to explain, very important.
It helps all sorts of disease entity in man. Cancer, diabetes, hypertension, high cholesterol, all this. Autophagy helps everybody, especially cancer patients. Intermittent fasting, and where autophagy is most important is in the brain. With ketosis, as you mentioned, ketosis repairs the brain's. They had said before that the brain cannot be repaired, but they have now found out it is not true. That ketosis, when you're in a ketotic state, they have found, and this is all on. You can look it up on the web, that they had put some. I think I mentioned that to you last time. Some psychiatric mental people, they locked them up and threw them in the dungeon and didn't feed them for a long, long time. And when they brought them out after years, they were normal. They were no longer mental patients. So you were surprised what ketosis can do and autophagy, and they go hand in hand. Never forget, with all of this, the fasting, etc., walking is very important.
Yeah, because when I'm in a fasting state, I exercise. Normally when I'm eating, sometimes I don't exercise. I'm not up to it. But because I have the time when I'm fasting, I make sure I exercise on a daily basis. I look at everything because there's so much more time. There's no eating downtime. Doc, a great part of how diabetics are affected is hypertension. Can we speak a little bit about hypertension?
Hypertension is known as the silent killer. No one checks their blood pressure, and unless they go to a doctor, hopefully. And then the blood pressure is so high, it bursts the vessels in the brain and you get stroke and so forth and so forth. That's what's called a silent killer. or it is so bad it can give you a heart attack. So heart attack and strokes are common complications of hypertension. So hypertension is called essential hypertension. Why is it called essential? Nobody really knows, but that's a name given to it because they can't find any cause of it. But hypertension, we go to a doctor, we get hypertension, they give us all these sorts of drugs, ACE inhibitor, so forth, and we drink those drugs. Remember one thing: the body does not like drugs. This is the number one thing. The body does not, your gut system don't like drugs. They identify it as a foreign substance. They throw it to the liver. But sometimes we do have to give drugs. But I just want to make an emphasis.
And when you say drugs, Doc, is there
Pharmaceutical drugs.
pharmaceutical, of which most are synthetic?
Oh, yes, they're all synthetic. They're all synthetic. But Ayurvedic drugs are usually herbs. They give you herbs like turmeric, which you know about, turmeric, garlic, ginger, lemon in hot water. All these things are so healthy for you. And when you drink those things, it works on our system, and realign or reset the system, so to speak. One thing I mentioned in the last 10-minute program is that 90% of our problems come from our gut. When we interfere with our gut bacteria, when we interfere with antibiotics or something that kills our gut bacteria, and we need good gut bacteria to improve our immune system. Because the immune system, which everybody knows what the immune system is where the body fights a disease. When the immune system is poor, like if you have HIV or something like that, your immunity goes down. That's very difficult. But the immune system is very important, and the gut gives you over 80 to 90% of your build up your immune system.
By the way, you guys could put your questions, our discussion today is diabetes and by extension hypertension. So you could put your questions if there are any specific questions and issues you specifically have. You could put it in the comments, and I would be more than willing to ask Doc, and obviously he's more than willing to answer those questions to the best of his ability. Yeah, Doc. So is there a correlation between diabetes and hypertension?
Yes. Well, there's a correlation between diabetes and high cholesterol, and but hypertension, when the patient becomes diabetic, usually the cholesterol metabolism gets upset, and that can cause the vessels to stiffen up. And what is hypertension? The heart pumps. It pumps a blood pressure of 120, let us say, and the vessels are not tight. So the blood goes nicely through the vessels. When the vessel becomes stiff, I'm using a common word. Mm-hmm. When the vessel becomes stiff, you're
it holds a certain amount of tension.
You got to produce more pressure to push the blood through. And the blood got to go through because the blood has to give to your fingers and to your toes and to your organs. So it needs much more pressure. So the left heart, so to speak, that's the heart that pumps the blood through the system. The left heart has to work harder. And when the left heart works harder, like when you go into a gym, when you work harder, what happens? Your muscle gets bigger. So when the left heart works harder, the left heart gets bigger. And you get people say, I get a enlarged heart. Enlarged heart from hypertension. You get it from other things too, but hypertension is one of the causes.
So in this case, what we're discussing, if I could break it down to have a better understanding.
Yes.
As a result of becoming a diabetic, it has a direct effect on the vessels, which affect the proper pumping or proper blood flow, gives a feedback to the heart.
It has an effect on the cholesterol metabolism.
Yeah.
And when that deposits in the vessels become harder.
The vessels are hardened.
Yeah. So the diabetes does not help you. But there are many diabetics who have normal blood pressure.
Okay.
Many diabetics who have normal blood pressure, and there are many diabetics who have abnormal blood pressure. And there are patients who had normal blood pressure, then they can become diabetic and then they get abnormal blood pressure. So it's not a hard and fast rule, so to speak, but it is there. But hypertension, the cause of it is mostly because of salt intake. That's the main cause, one of the main causes of hypertension. We eat too much salt, chips, anything in a bag you eat, vegetable oil, these sesame seed oil, sunflower seed oil. They all have so much of these GMOs in them. They're packed, they're preserved, they're no good. So we should not eat that. But I want to tell you something which is very revolutionary. We just come out recently. In your mouth, there's something called nitric oxide. Remember that nitric oxide. It's produced by the lining of your blood vessel, but it only lasts for 1 second. A gentleman just got a Nobel Peace Prize for this, for the work on nitric oxide in the blood vessel. And nitric oxide in your mouth, you have nitrates. Those nitrates go down into the stomach and is converted into nitric oxide. But you'll be surprised to know, if you use mouthwash, you kill those bacteria.
That creates the nitric oxide.
That creates the nitric oxide. Mouthwash, and this would surprise you more than anything, fluoride. You know, all dentists says that you must use fluoride in your toothpaste. If you get Crest toothpaste, whatever toothpaste, they got fluoride. Fluoride kills also the mouth bacteria. So that is very important.
We have a far way to go.
And there's something called L-arginine and citrulline. You can get this in the over the counter. L-arginine, and citrulline, citrulline. You can buy this as over the counter and use them, and they create nitric oxide in your body. And what the nitric oxide does, it makes the vessels soft. Soft is not a medical word, but let me just let the people understand. Instead of being stiff, it's soft, so the blood flows much easier. Arginine, citrulline, your insulin must be well controlled, your insulin, and exercise. Exercise in every single thing. Exercise is there.
Are there studies, or can you say definitely there is cases where people have developed hypertension and then as a result of fasting and diet have been able to eradicate that condition?
Absolutely, especially if they lose weight. If they're overweight and they lose weight, they can reverse back their hypertension. Obesity, overweight is one of the great factors that cause hypertension. And any doctor will tell you, if a patient is overweight and they come with hypertension, and he puts them, says, you lose 25 pounds. When a patient hears that he has to lose 25 pounds, he goes into depression right away because he feels that's impossible because he can't stop eating.
It's not hard.
Why he got big? Because he loves to eat. And as I said, even the old physicians like Socrates and all these, they're not physicians, philosophers, Socrates and Hippocrates, they all talk about we eat too much. If you eat to live, if you live to eat only, you are going to suffer. But if you just eat just to live a little bit, then your stomach must only be half of food, or a quarter of water, and the other quarter must be air. But what we do when we taste something and it tastes nice, we can't stop eating it.
No, but Doc, one of the problems that our society have, and I'm constantly looking at people, and sometimes I get, I got my personal issues where I'm easily angered by stupidity. But I look at and I'm saying I'm here. And I'm a living example of how fasting can change your life. And it has changed my life physically, mentally. And financially. Because as a result of me being physically fit and expressing a certain level of mental clarity. I've been
Clarity.
able to concentrate more on my business.
Yeah, that's very good.
I've even seen successes there. But when you go out now and you look at me and say, why can't you do it? But they have an uphill battle because they're going into the supermarkets, everything is packaged. Now, Doc, my lunch today, I start breakfast, which is breaking the fast, at 11 o'clock, between 11 and 12 o'clock. And I did so 11:30 today. So I had pear. I had a couple of pears peeled. I had some walnuts and some other nuts. So 2 sets of nuts and pear.
Walnuts are shaped like the brain, you know that.
Yeah.
So it's a brain food. No, I'm serious.
Yeah. Well, I just forget the name, right? So I said, man, the nuts are looking like the brain, right? So that's what I had today to start my lunch. You were not vegan,
No, vegetarian.
a vegetarian, but I like my proteins and I prefer a carnivore diet. So I do pair. And again, I'm very selective about what I eat purposefully.
Yes.
I'm eating pear because of the nutrients that I could get out of it and because it has good fats, and also it's high in fiber.
Yeah.
Right?
That pear and the saturated fats and good butter and ghee, all these are good fats because they increase something in your blood called HDL, high density lipoprotein, which is most important in your body because it's a scavenger. HDL is a scavenger. Remember that today. HDL is a scavenger. It scavenges the arteries of all the deposit of cholesterol and throw it into the liver, and the liver get rid of it as bile salts, etc. So HDL in the Indian population that we have seen in Canada and over here, the HDL is mostly below 1. And your HDL should be at least 1.3, 1.4, 1.5. And the more your HDL is the better of a scavenging system you have in your arterial system.
Yeah. So just for you guys to understand, again, in addressing the issue, and Doc is here, and I've presented myself as the guinea pig for this, unlike people who are reading up on what studies have been done and where it's been done. I am going through this process. So fasting is known to, and because of the process, when in a fasting state, is known to reverse diabetes, is known to reverse hypertension, is known to help you balance out your gut, which is very important for overall health.
90% of the problems come from our gut.
90%, as Doc says, 90% of the problems comes from poor gut health. And I could tell you that.
A leaky gut.
Here was the funny thing, Doc. So I used to get born stomach because I eat and gonna lie down right away after. And if you trace these things, if your insulin is well balanced, if you diet and you're eating the right foods, you don't get sleepy right away after you eat. You notice no imbalance, right? But if you're high on sugars and all these kind of things, so then you eat right away after you want to sleep. So I used to go and lie down. I started developing a stomach problem. And I started doing my research and I started fasting. And I thought, and most people think, burn stomach is as a result of too much acid.
No, it is because of less acid.
It is a result of lacking of acid. So when I learned about apple cider vinegar...
But how come you know all these critics?
I read all the time.
You look a doctor, man.
Plus test.
Not many doctors do that.
Right? So I said, Tom's, if you thinking on the acid, then I realized you're feeling it here.
You're creating a worse
situation. Right? So I use the apple cider vinegar.
That's right.
And the honest truth is, not everything adds up to logic. Because when one is going to tell you a burn stomach, you're feeling the burning, suggesting that acid causes that, and you feel the burn stomach, somebody saying you gotta get more acid, you say no, because it's not logical. But this is not logical. You have to look at the facts. No, there's a valve here just at the top of the stomach. And if the stomach has enough acids, that valve
stays
closed, right?
Yep.
Now, what happens is when you eat, the stomach starts boiling up with a lacking of acid. The valve is open, and if you lie down or anything, the acid keeps coming up, right? If you have the right amount of acid in your stomach, it starts to deal with the food and the breakdown of the food and the enzymes right away within the food. That process in the stomach starts in the digestive system, right? So using the apple cider vinegar, I solved that problem. Then I didn't just use it as a miracle drug. When I started fasting and my stomach balanced out, because people are saying, one must know, the digestive process starts from in the mouth. So when you chew,
that is why you must chew your food for a long time.
When you chew, it tells the gut also.
Because there's an enzyme in the saliva called ptyalin. Is a silent P, P-T-Y-A-L-I-N, ptyalin, and that has to. That's the as you said, the digestion starts there. It mixes up with the saliva in the food. You know, some people can eat a piece of bread in a whole bread in 2 minutes, and some people can take the time and eat one slice as much time in one slice. So it's very incumbent upon us to chew our food properly.
By the way, also while you're chewing that food, it tells the gut that food is coming.
Prepare.
The gut starts preparing more acids. So with the fasting, a lot of people say, how you go fast? The stomach acid gone down. No, I don't get wind pain anymore, Doc. I don't get wind pain. I fast, not eating 7 days. I don't get wind pains. There's no build-up, because once the body gets accustomed to it naturally, it makes accommodation and adjustment for better, healthier life, a better, healthier gut system. And that got fancy words like the biome and all them things. I try to break it down for y'all, understand what's going on, right? So again, the acids I stopped using. From time to time, I use the apple cider vinegar because I'm still looking to lose about 15 pounds. I got some fatty, right? That I want to get rid of and get toned, because I want to show people the extremes. And what I've been doing also, Doc, is not just doing this. So my personal physician, when he sees me, say, man, what you doing, buddy? Take your time. Why you so extreme, right? But remember, I know how I am feeling. I'm also doing my research. And what I've done is take blood tests. So I test my protein. I test everything. Recently, I had an extensive array of blood tests. And everything is okay, right? The first 24 hours of fasting. So I went on the 5 days diet, fasting. And you can feel how you re-energize. You feel the clarity. You don't feel hungry. And after fasting a few times, you develop a certain level of discipline that affords you the opportunity to look at what you eat. Like I make eating a style, a pattern, a way of life. And like we'll just stop in the face, you just eat and move on. Oh, let me get some lunch. Is this what they need for energy? But if one puts thought into what they eat, in the fact that I eat pears for this, I eat nuts for this. You understand? Specifically, because if someone eats a plate of rice with some curry up top, they don't really know, except for the chicken with the protein, what are the other things you get. And a lot of what you're getting in it might be negative.
Carbohydrates.
What are some of the things that we could eat that will see us reversing, or what would you recommend to people with hypertension, Doc, as diet?
Very simple. Salt. NO. If your hypertension is high, no salt. When you go to a doctor and you have hypertension and it's a mild hypertension, he gives you something that is called a diuretic. A diuretic is allow you to pee out salt. So to make your hypertension better, you eat no salt. Why? Hundreds of years ago, our people were hunter-gatherers. They used to go without food for 2, 3 days. Then they go for a hunt on the sea, and then they get food and they bring it back. And they only eat when they are hungry. That's another thing. Eat when you are hungry. Not eat because you have to eat. This is a big disease. So with hypertension, cut out the salt. Eat green leafy vegetables, arugula and all those sort of things. The greener the vegetable is, and when the green vegetable gets a little purple color to it, that those kind of things, that has a lot of nitric oxide. Get the nitric oxide into your system. That will lower your blood pressure. Cut out the salt, get the nitric acid into your system, and see whether you can just, if you're severe hypertension, you can come down to managing it by, instead of all those big type of tablets, whose names I will not call here, you use a simple diuretic. And if you're on a simple diuretic, you can cut that out. If you exercise, you got to exercise. You have to exercise. You have to walk. You cannot beat hypertension unless you walk, you lose weight, you eat no salt, you eat green leafy vegetables, you try to don't use any mouthwash in your mouth. And if you're strong enough and you believe in fluoride, a lot of dentists say you must have fluoride. Fluoride kills the good bacteria that converts from nitrate to nitric oxide. If you can do that, and exercise every day, you don't have to go on a big exercise, 20 minutes, but you can.
When you say exercise,
walk. You can walk.
For instance, I do an hour of walking that adds up to 10,000 steps, 5 miles a day. Yeah. Every evening I do that, or very early in the morning. Yeah. A simple walk.
But they don't have to walk that much. If you can walk 4,000 steps, let us say because you're old or you're fat, you don't want to walk too hard, your knees are hurting you. Oh, just walk
4,000 steps.
5,000 steps. But if somebody's young like you and strong like you, 10,000 steps, that's fine. But 4,000 to 5,000 steps, don't worry if 10,000, and because you get depressed right away. Oh no, I got to walk 10,000 steps. No. And you'll be surprised how you can walk 4,000 to 5,000 steps just walking in your house. And don't frighten to walk upstairs. That is where you burn the calories. Walk upstairs. If you're in a building, office building, and there's an elevator, and you have
use the stairs,
and you have to go up 2 stairs, you use the stairs.
Use the stairs.
Not 1 stair, even 2 stairs. If you got to blow and stop at the first stairs, fine. Stop, blow, walk again to the second stairs. Walking up incline is very important, because the incline give you the heart pumping and what you need, and this is where it's so important for you to produce your energy.
Doc, before we came on in the program, you were giving me some statistics about 50% of
Alzheimer's. 50% of people, 50 million people get Alzheimer's in 2050.
Wow.
According to the statistics. And that is because Alzheimer's, I mentioned it to you last time, and people might have forgotten, is type 3 diabetes. And you mentioned the word this morning, and I don't know if you remember, you mentioned it. The blood flow has to be good. You remember you said that? Mm-hmm. The blood flow to the brain cuts down with diabetes. Diabetes makes as the blood vessels small, as I told you. It cuts down the blood flow to the brain. When the blood flow is cut down to the brain, and we have all sorts of deposits in the brain, like metallic deposits, lead, copper, all of the deposits in the brain, and then you eat things like antioxidants to take away what is called free. Am I getting too?
No. When you think I can, I know what they know. Don't worry.
Okay. These are things called free radicals in your brain and your body, and you want to get rid of them. And you get rid of them by drinking green tea, eating these flavonoids, we call flavonoids.
That are high in antioxidants.
Like blueberry, blackberry, strawberry, pomegranate. You know the cherry you get in Guyana? Not the cherry you get imported cherry. The cherry is grown on the tree, but you don't see it because people like you break them down and put up buildings. So there's no there's no more cherry tree. The cherry tree, and you know what is good? Gooseberry.
Gooseberry.
When last you eat gooseberry?
I looking for them here. Why? I, being a patriot, like, I know it's the berry family we're working on,
Berry
right?
family.
So I try to stay within what we could get locally.
That is it. That is the best. That's the best. The
Yes,
cherry.
the gooseberry, the local cherry.
We can't get gooseberry.
yeah.
It's called amla in Ayurvedic medicine.
Yeah.
Amla.
Gooseberries, yeah.
Gooseberry.
So I look for gooseberries and I look for the regular cherries, right?
And another thing, talking about dieting, is to fermented foods are the best foods to eat. Sauerkraut, sauerkraut, cabbage, you ferment it. It's called sauerkraut. Yogurt, dahi, we call that. All these fermented things. And in India, they just make yogurt for everybody. Eat yogurt every day. And there's something called idli in the south of India. They make something called idli. All these are fermented foods. And if you want to do anything that you want to eat, and you know what I think called moong dal?
No.
No, it's a green dal, and you put it 2 days in water, 1 day, and it sprout. You must look it up. Moong dal, Moong dal, moong dal, sprouted moong dal, give you the best. One of them that give you lots of antioxidants. And you put a onion on it, you put a little olive oil on it, and one thing that you must drink if you want to be healthy is olive oil. When you drink olive oil and vitamin D, you drink vitamin D, and there's a vitamin D which combines with K2. I mentioned that on your program. Vitamin D, K2, MK7. You can get that, and I don't know if you get it here, but we're going to try to get it at the place. Vitamin D is a one tablet. It gives you vitamin D, and what the K2 does, you can't remember. The K2 removes calcium, where calcium is not supposed to
Cancel
be
deposit in the vessels.
to your heart, to the bones. Yeah. They're very important. These are very new things.
Doc, you said olive oil.
Olive oil.
Can we replace that in any way with coconut oil?
Oh yes,
Natural coconut oil.
olive oil or coconut oil.
Or coconut oil. Because, again, when you talk about things, I looking for we local thing, what we could use here.
Coconut oil.
Yeah, because the Alfonso.
It gotta be good coconut oil.
Yeah, no, because not a coconut oil we is bond and rub skin with long time and so.
Right.
Because they're actually turning it into a saturated product.
Right.
Now they're cold pressed coconut oil, virgin coconut oil. When you rest it down,
Yes.
in room temperature is turned white. It starts solidifying.
So, correct.
Right? That there
That is coconut oil.
is real coconut oil is good. And again,
One tablespoonful in the morning, you're perfect.
yeah, goes through the system. It does miracles for you. So I'm looking at what we could do.
What does that do? Those things increase. I mentioned it to you. You might have forgotten your HDL, your good cholesterol. Cholesterol is not bad. We need cholesterol. We produce 3,000 grams of cholesterol every day in our body because cholesterol is important for hormones, testosterone, all these things is important for progesterone, it's important for the cell building, it's important for everything. So cholesterol is important. And when you block the cholesterol by using Crestor and Lipitor and all these fancy drugs which doctors gives you right away, it blocks the cholesterol from forming and prevents all these good things from happening. I'm not saying that you shouldn't get it, but only in specific circumstances.
Doc, again, to the viewers, just to bring some clarity, because you would have a bit of confusion when listening to Doc saying cholesterol is good. There was a demonization of cholesterol in the past by people with great business interests, pharmaceuticals, and everybody else to stay away from the fact that sugar was the problem. Right? There was a demonization to stay away from the fact that sugar was the problem.
Right.
The problem was sugar all the time.
All the time.
People were playing politics, major companies onto today. They're still not accepting and dealing with like the other day there was a food pyramid made in the USA where Fruity Loops was at the
Fruit
top
Loops, right.
of the food pyramid.
Right.
It was crazy.
Right.
How could Fruit of the Loops
Cannot be
be at the top of the food pyramid, a healthy food?
All cereals are bad. Hear it from me today. All cereals are bad. Do not try to say, "Oh, I just had a bowl of cereal." No, that's no good.
Doc,
Full of sugar.
I think one of the things is misinformation, or people misunderstanding or misinterpreting the information they get. Because in dealing with processed foods, we don't eat. We are fed. A lot of people don't get the concept of eating and being fed. Now, if you were to juice a fruit, it takes away a certain process of eating. If you eat an orange, you get fiber because you're eating the orange, those the solid parts of it, you get fiber.
I stick a pin. And the gut bacteria loves
fiber.
Don't forget that. The gut bacteria
fiber
loves fiber. And you can't get fiber from a squeezed thing. You get fiber when you eat the orange and swallow the whatever.
You cut processes.
To the peel. You go as close as possible to the peel.
You cut processes when you squeeze the orange. When you eat, there is a balance created in how your body addresses the sugar, right? In terms of the amount of insulin that is created because of the process and how you eat. When you drink the juice and the juice flies straight past your tongue and goes straight to your mouth, it kicks into high gear and overcompensate with insulin.
Of course.
That is how you end up developing insulin resistance and getting problems.
You know all these big words, man.
No, Doc, I'm checking this already.
Not many people know what insulin resistance is. That's very good.
So, right away,
is it insulin resistance that cause the eyes to go bad? You know, how many diabetics can't see, and how many diabetics are blind? Good, upper strata people, they're not controlling diabetes, they go blind. Insulin resistance is called IR, bad disease.
We have to have more of these discussions because of the fact that the modern day citizen, is being fed. You're not eating, you're assuming you're eating. But if you look at the cereal, why you can't date? So they gotta take color, crush a bean or a grain and mix it with sugar and paste it together and then put it in a box for you. You can't just pick up something naturally and eat it.
You know what like sugar? What is the love of sugar in the body?
Cancer loves sugar. Cancer feeds on sugar.
You know you don't need me in this program.
No, you got to hear.
No, you're wasting it.
You is the duck. If I talk alone, I can be the quack. Yes, sir.
Cancer loves sugar. You know, I think I told you this the last time, and I repeat it again. When they want to find out whether the cancer has spread into your body, they don't have it in this country. There's something called PET scan. They go to a PET scan. Before the PET scan, they have to inject you with sugar. And if the cancer is a different part of the body, the cancer picks up the sugar. That's how they know the cancer is there. That is how close an affinity is cancer, a sugar with cancer.
We got to do many more of this. So let me get this. Howard is saying Doc should explain the safe and required range of all necessary nutrients and vitamin level that necessary for good health. Not enough or too much of one thing could cause medical problems. The body has a way of writing itself. Right. And how do you get too much of one thing if you're being aware? Now,
vitamins.
If you're a hog, like for instance, vitamin C, you can't use too much of vitamin C. The body immediately disposes of it. You understand? Potassium. You're supposed to eat a bunch of banana. You know? You're supposed to eat a bunch of banana.
Except if you're diabetic, because it has a lot of sugar.
Well,
banana has a lot of sugar.
No, what I mean?
Yeah, but
you don't want to eat a bunch of banana. You know, you don't get overdose of potassium if you eat a bunch of banana. Right? So you're not supposed to be eating no quack duck. Lo real duck speaks. Hey man, you know, this is what is it about keeping it real with the people duck and them understanding and we sharing and I think there needs to be more of this.
Sure.
So we're just about closing up on our hour, and we can't close up. We got basically about 10 minutes more. We can't close up without recognizing Dr. Doobay's and the Gafour's center that deals with diabetics and dialysis on the East Coast at Annandale. And Doc is going to give us a little bit of background and a reminder of what they do there and how they could afford you the opportunity. And not only that, you know, a lot of this is done out of the good will of sponsors, the founders, that and Gafour's being the founders of the Doobay Clinic, Doobay Gafour Clinic, and a lot of people who put in to make this a reality for a lot of times people who are very unfortunate and can't afford dialysis. That makes that happen. Give us a little bit, Doc. By the way, the interview we had recently has not been aired. I'm going to structure it and edit it.
Sure.
So give us a little bit about what's been going on recently, what's the clinic been doing, how is it been going for you guys, and how people can help if they want to.
Our clinic's motto is that no one will be turned away because of lack of funds. The government of Guyana has given $600,000. Unfortunately, the money is given to the people.
$600,000 per person.
Per person per year.
To deal with dialysis. Correct. For dialysis patients.
So they get a lump sum of $600,000. Some people feel that, well, maybe they buy a car and they can work back the money, and then what happens after halfway, 6 months, they have no more money for dialysis. But anyhow, we try to give dialysis to everybody. We don't turn away anybody. If you go to our center, when you see people who are have no legs, who are blind, they are so poor. You can look at the shirt. The shirt are torn, the shoes are torn. They have no money. We charge a little bit more to subsidize the running, and we lose about $150,000 US a year because we are running 3 centers now, and we are going to do a 4th center in Diamond through the courtesy of Komal Samro and DDL. And we also have 2 directors also, Ganesh Prasad Roop and Najab, who helps us quite a bit in this venture. So when a doctor, nephrologist, a professor of nephrology was there 3 weeks ago, and he said to me, there are 25 patients that need a 3rd dialysis, but they can't afford it. Remember, this money, 2 dialysis per week for a year. But he says, no, he identified 25 people that
who need more dialysis.
Because they are working people and they can't function with 2. And they don't have any money. You have to get the money. You have to do the dialysis. So I said, okay, because we are working with McMaster, so we give these patients, these 25 patients are going to get free dialysis, 1 free dialysis every week from our center, because we want them to be functional citizens. And all these things cost us money, and but we beg and we are asking through this program, if people are there and they want to help, to do a cost of 1 dialysis or whatever help they can give, that's fine. We convert.
How can they get to do that? Let's say a business entity. Who do they reach out to?
To the Doobay Gafour Medical Center in Annandale.
Annandale, yeah.
And there's Zahir, who is our CEO, and they can contact him. It's in there's a website. And there's
so you could go to the Doobay and Gafour
Medical Renal Center.
Medical Renal Center. You go to the website and you could reach out. You'll have all the contact information there. And in the event you would like to help, and I can tell you, I'll be doing some programs there soon. I'll be interviewing people. These people need this help. I've been there, and diabetes isn't sparing anyone. You have young people, you have most of the people are obese, but you have fine people, you got fat people, you got good people, you got bad. It is sparing nobody. And too many young people are turning up now. And again, I'm saying at the dialysis center, they're gone. Bear in mind, this is a lease on time, not life. This is just a lease on time. Once you reach the stage of dialysis, it's years we're talking about. So imagine a young person experiencing that. Dialysis is the kidneys already give up. You don't know what else in the body is going to give up later down the road. It's not easy. So if there's any help you can give, please reach out and do so.
So these people, the young people, sometimes they're not. It's not their fault, and they lose their kidney, and if they can be transplanted, it will be very good for them because they can live a normal life afterwards. So transplantation in these people is a very good option for them to get out of dialysis. I would like to say dialysis is not a good thing. No one should want to go on dialysis. I will be the first one to be so happy if we have no dialysis in Guyana. But unfortunately, in every 1,000 people, one person will be dialyzed. We have not touched the surface yet in this country because doctors are still not making a diagnosis and they make it so late sometimes. And remember, in the far off places, so far we are in the bush and all those places, we don't see people coming from there. And I'm sure because in the First Nations people, diabetes is a very high complication. And I'm surprised that there are not more people because our center is the biggest center, and we would know. We did have a few from Pomeroon, and some of them had lupus, some of them had diabetes, and unfortunately they died.
No, but again, Doc, what is it to get the statistic? It's not very hard to come to a conclusion because the fact that diabetes is a lifestyle disease.
Correct.
And for the most part, most Guyanese get the same lifestyle. It has to do with our eating practices, lacking of exercise, and all these kind of things.
Correct.
We all got the same habit.
Two things: eating, exercise.
Yeah. So again, recently you had some surgeons come from Canada.
We had a team of surgeons came and we operated there, and we did 35 fistulas. Fistula is you do a little operation in the hand here to take out so that they don't have this cannula in the big vein. Because this cannula gets infected, they die. Because they don't care it very well. So we did some which were done before. There was one man who was done 3 times, so he only had one chance. He was done here, he was done here, he was done here, and he only had this one. And he's from Georgetown. And we did him. So far, it's working well, but they're very difficult. I can see why it blocked up because the veins were very small. So you got to be very, very, very careful. It looks like a very small operation, but it's very technical, delicate, because a small artery and a small vein, you're joining it.
You're joining an artery and a vein.
And if you take your bites too big, it's called purse string. You know, the vein blocks up the artery and it does not work. Okay.
So and the intention there is to have an entry point for when you're coming to do your dialysis. This is dialysis patients, and Doc recently had one doctor from all the doctors are from Canada, but they're from different places in the world. And Doc has been able to convince them to come and serve Guyanese free of cost. And these doctors paying their own the airfare to come and the hotel and all in there, and also coming and serving Guyanese free of cost. Right? So Doc, we want to thank you for that.
Thank you.
And we're structuring, myself and Doc is structuring how we're going to be doing this program constantly, because Doc is heading back to Canada. You spend most of your time in Canada, right?
Right.
So Doc is heading back to Canada. Hopefully he'll be back here soon, but we have to find a way that we can have these discussions with Doc over there and help with the educational process. I am still going through and always will be on the forefront of explaining to you what is, healthy ways of living, how diet works for me, how it's worked for me, how fasting has worked for me, how my life has changed as a result of that. And I'm saying mentally, physically, and financially. Because some people, the interest is finances, I can tell you, in living a longer, healthier, better life, in having a better gut, system, in having clarity, the only way you can go is up. The only thing you can be is more successful, because the kind of effort that is put in to streamlining one's life. If you look at businesses and its failure, it has to do with the lacking of prudence. It has to do with the lacking of good principles. It has to do with the lacking of consistency. And if one is going to look at one's life and develop consistency in one's lifestyle, prudence with what one eats and all these kind of things, that translate, because it becomes attitude now. We develop practices and attitudes and habits over periods of time. And once you develop good practices and habits that nurture principles, that transfers in your whole life. I can tell you I've been successful all my life. I wasn't always persistent, So a smart, yes, I know how to do business and so, but then I build a big business and poor management. Like when I'm done, I'm watching at my program for an hour and I'm thinking 8 o'clock is the next meeting. I need to wrap this up. Today I sit down and I calculate, well, I waited for Doc because we had a little back and forth between 10:30 and 12:30. And I'm thinking, I waited for Doc. What are you doing in the meantime? I stand there for paper, right? If I said, bring the calculator, I go read this 4 paper, figure out if I could find anything in the paper of substance. What am I going to do, right? So in good, healthy practices inward, because there is nothing else. Going to the university and learning, right? Or developing a skill. It is a structure. It is memory that is being placed into you. It is practice that is being placed into you to come out and say, well, I have a doctor, I'm a doctor in this field, So in that is good living practices. And if that is what we got to tell people, or not just tell them, what we got to show them that's going to entice them to want to live a better, healthier life. Because right away, it was the other way around for me. I'm thinking, no, I'm coming into some finances. Me want to spend me money at the hospital. I want to spend my money on other things. So I'm going to live a healthy life. I had lunch, pear, my meats, my nuts and all them things. And I call it a day. 6 o'clock, I go for my walk, calculate, I'm back by 7 o'clock. I read for an hour. 9 o'clock, I die in my bed. You plan that. And if you plan that, if you apply that to different ways, your relationship is going to be better. Everything is going to be better in your life. Doc, I want to thank you once again for coming and, making yourself available to help Guyanese. I want to thank, I don't know if you want to thank your sponsors, because this basically program and the Doobay Gafur's clinic. So if you could just name the sponsors and thank them.
Well, I will thank, first of all, Mr. Satar, Gafur, and Amina. They have been the biggest sponsors for us. We have the Komal Samaru in DDL is doing this dialysis center for us. Najab from Najab Trading, Roop from Ganesh Parts, and we have IDRF, which is the big place. The Biharis, they have also sponsored our lab, and so many other people who have given so much to our place. So all those people.
Please make mention of the 3 doctors that recently came to.
Dr. Ram Mohan, of course, Dr. Naji, Faisal Naji, and Dr. Jennifer Frendo. They came and they gave.
They recently came and played an integral role in getting things done for your clinic and by extension, the patients there. For you, the viewers, I want to thank you for tuning in, and I'm hoping this has been educational for you. I look forward to many more like this. Again, thank you, Dr. Doobay. Thanks a million.
Thanks.